Welcome to another episode of Influences in Dentistry. I'm Dr. Geeta and I'm excited to share the inspiring conversation with you today. Let's dive in and learn from another amazing dental professional. Welcome to Dental Focus Marketing's Influences in Dentistry podcast. And today I have a special guest who needs no introduction, Dr. Derek Mahony.
Hi.
Hi, and I'm just going to give a little snippet about what you have done. You've done your undergraduate in dentistry in Sydney.
Correct, yep.
And then you went to London and you did your specialization in orthodontics, and then dentofacial orthopedics in Scotland. And if that wasn't enough, then you went on to learn about sleep medicine in Western Australia through the City of London Uni. You own 15 practices under the Full Face Orthodontics umbrella, and you've also taught thousands of dentists, clinicians, orthodontists, mainly through your EODO mini residency. And outside of the clinic, you're also just as passionate about your vineyards and your signature wine label. So welcome, Derek. Thank you for coming on the podcast.
Well, thanks for the invitation. I've seen quite a few of your podcasts. I quite enjoy them. You get to know the man behind the name, or a little bit a deeper dive on what makes people tick. I think in our profession, everyone focuses. If you get a group of dentists together, you always see actions like this, and they're talking about teeth, but there's not really much of a conversation about other things.
Yeah.
So I think your podcasts are great.
I'm really excited that you're here because I know a little part of your journey, but I don't know the full extent of your journey. Mm-hmm. So I want us to step into a time machine and go back to your younger years, before you even graduated as a dentist. And where did it begin? Did somebody say to you, hey, look into this field? Or did you have that strict parent that was telling you,
I can answer
do dentistry?
I can answer that one easily. I was, the son of first immigration migrants to Australia, who kind of left their country to give their kids a better start in life. So there's this definite, from kindergarten, and my mum was a school teacher, right? So there was this sort of, underlying understanding that I'd have to work hard and have to do well.
Yeah.
Almost to the degree of, become a doctor, a dentist, a lawyer, or an engineer, or just don't come home. That was the kind of genre. Yeah. I came from a very working class background. So even though I've done, really well in life financially, I know what it's like to have nothing. Yeah. My parents were on the immigration scheme where literally they could bring $10 sort of thing, and I grew up in very basic dwelling out in the west, in Liverpool, mm-hmm. where my mum got a job as a school teacher, and I was 3 at the time, and you couldn't start kindergarten until you were 5,
Right.
But being Catholic school education system, and they needed teachers, my mum made a deal with the principal that I'd go to kindy at 3.
Oh, right.
And I'd just sit there until I was, repeat 2-3 years and then start with everyone else. But I seemed to do pretty well in kindy, and I just sort of progressed up. So people don't realize, this is a fun fact, I was actually a dentist before I turned 21.
Wow.
Because of that head start.
Yeah, amazing.
Which made a big impact. I've been in this field now 38 years, but I still feel I've got energy, etc., where I look at other specialists who've done that number of years of specialty compared to me, and they're kind of at their retirement age. So I think it was a kind of a nice thing to, start school early, do dental school early, get into orthodontics early. So
amazing.
You're asking about my passion. I really didn't like dentistry. So
I was going to come to that.
Okay, all right.
So you graduated as a dentist,
mm-hmm, mm-hmm.
and then you realized that general dentistry wasn't for you.
Oh, 100%. I wanted to do med, and I think I was 2 marks shy of, back then they called it the HSC certificate.
Yes.
I remember it was out of 500 and you needed 492 for med or something like that. and I think I still remember these numbers, I got 490, you know. So it was a case of, do I redo a whole final year, or do I just go with something else, you know?
Yeah.
And I decided I'll go with dentistry and hope to transfer into med after first or second year. That was the goal.
Yeah.
And I found a good group of friends in my first year in dental school.
Yeah.
So it kind of like made it, you know, I thought, then I changed my mind and said, look, I might as well just finish dentistry and use it as a stepping stone to something else. Yes. I always knew I was never going to be a dentist.
Okay,
right?
so you knew that right from the start.
I knew that, yeah.
So what was that turning point for you then to then specialize into orthodontics?
Well, my orthodontist was a young guy, and you know, back then had a brand new Porsche. He had a pretty good lifestyle, and you know, it wasn't like how can I put it? When I did dentistry, you know, there was surgery, there was root canal, there was all sorts of stuff that I wouldn't say I would enjoy doing.
Yeah.
Orthodontics was the best thing ever. I mean, this guy ran a classic harem practice, you know, where he just pointed and the girls ran around, did everything, and he'd be on the phone or chatting, you know, and I thought, wow, this is something I'd like to do.
Yeah.
So to be honest with you, I saw the lifestyle you could have, and I could see. And this young guy just bought the practice from another orthodontist who was only working part-time. Now that guy was 80-something, but he was still coming to work, because I quickly realized that you don't need good eyes or good hands. You just need a good team.
Yes.
And to this day, you ask any dentist and they view the word orthodontist with delegator.
Yeah.
You know, so I think that appealed to me. Yeah. But I only really enrolled in orthodontic school after I took about a year off from finishing dentistry.
Okay.
Yeah.
Okay, that's
so that gave me
interesting.
time to figure out what I wanted to do.
Yeah. So then you specialized in orthodontics, and tell me a little bit about your philosophy in early intervention and airway. How did that start to form? How did it evolve? And for our audience out there who are listening, tell them a little bit about your philosophy.
Yeah, so my philosophy in orthodontics was very traditional, routine. I trained in a program in London. You know, it was a classic orthodontic program where you learn how to straighten teeth and how to bend wires and move teeth from position A to position B. And that to me was what orthodontics was all about. Now, just, you know, fortunate for me, in my last year, it was a 3-year program, you had to do some independent research, right? And I was in London, I was dating a girl who was Swedish, and I'd done trips back and forth. The good thing about training in London or living in London was, you know, you could fly anywhere in a short time, right? And so I went to Sweden, and I just loved Sweden. And so I applied for a fellowship for research at a famous faculty at Karolinska Institute, Huddinge, Stockholm, Sweden. And there I met Professor Sten Linde Aronson. He totally changed the way I thought about orthodontics, you know?
Yeah.
He had just finished his classic long-term research. We looked at paired children who had airway problems and had adenoids removed.
Right.
And he looked at how their face changed and what happened to their teeth, and he measured 172 variables in this cohort of people who are nasal breathers, people who are mouth breathers. And to me, it sort of, you know, the penny dropped that if you're going to get a good-looking face, if you're going to get a child who sleeps well and does well at school, it's all about the airway.
Yeah.
So I was just lucky that I love Sweden. I wanted to do some research. To be honest with you, I was happy to do whatever research he wanted me to do. And his deal was airway. So I sat there and traced, I don't know, 1 million x-rays comparing facial changes pre and post airway, and you know, I could see, wow, this is crazy. So I stayed on a little bit longer and learned his philosophy and what he was doing, and that sort of changed the pathway. So I wanted to stay in London. I loved it, you know, but recently married at that stage. We had no family support in London. My wife said, there's no way our first kid's going to be born in UK. We need to go back to Australia, you know. So that's where I went. And I think financially, great decision to come back to Australia. In my profession, I look at people my vintage in the UK, and they're doing well, but I mean, the financial gain under National Health Service in London, even if you did a bit of private practice, nothing to compare to Oz. You know? So that was probably a good thing. But when I came back to Australia, I did two things that no one had ever done. Number one is I set up my own practice, you know, which back then, this is the way you got into ortho. You trained at Sydney Uni, you worked for one of your tutors at Sydney Uni, and you slowly bought out that same guy. And it was this, you know, ongoing, nepotistic, you know, blah, blah, blah. I came back and said, I don't want to do what I was taught in ortho school, which was take out 4 teeth and line everything up, in the process do a lot of retraction, because I could see the impact that was having on airway from what I saw in Sweden. And in Sweden I met amazing people from mainland Europe. So, you know, even though the UK was European, it's not European, right? At all, okay? I don't have to tell you that, right? Brexit aside and all that, right? The UK was a very different way of doing orthodontics compared to the other parts of Europe, Germany, France, you know. They were all doing interceptive treatment. They were using removable appliances to make room. And I was seeing just amazing results, better faces than I'd ever seen with the retractive type of orthodontics. So, you know, what do you call it, the European philosophy or whatever else, that's where I brought back to Australia. So rule number one, thing I didn't do out of the ordinary, I set up my own practice. And number two, I was encouraging dentists to refer kids to me at 7. Which was not heard of. Remember, this is a long time ago, right?
Even at my stage,
not
many were doing that.
And I was explaining why, and I was explaining what I could do for them, and showing case studies, and you know, it was and I was amazed at the response, because dentists wanted this, parents wanted this, you know. I mean, it's common sense when you think about it, and that's what launched me from having one little practice. I remember it distinctly. My first practice was in Randwick. Practice was downstairs. We lived upstairs with our 1-year-old, 2-year-old son. My wife was sort of part-time receptionist, and you know, it was just one nurse, myself. And from that, we've grown rapidly because of what we offered. You know, I don't think I'm an exceptional clinician. I don't think my skills are better than anyone else. But it was a philosophy that I would say changed the way orthodontics is done in Australia. No doubt about it. And nowadays you get so many people doing exactly what I do, right? Which is great. I wish more would. But the impact that parents get with taking teeth out or not, I guess there was a shady period of my career where I went on national TV to just talk about what I thought is a good way of orthodontics. But you know, media being media, they will, you know, make it a twister, you know. So I did this thing on 60 Minutes, right? Now to this day, I believe it's the most watched Australian 60 Minutes ever.
Famous.
On replays and all that, right? It was about, there is an alternative way. That was it. It wasn't like, let's create an argument when you do this, I don't know. It's just this case that this is an alternative. If you treat the kid early and you widen the jaw, you don't have to take teeth out. And if you don't take teeth out, that's going to give the kid all the stuff that, you know, But my God, that created, you know, so much drama between myself and the establishment, I think you want to call it that. So that was a, you know, I'm talking about things I remember in my career path to get me to where I am today. But because I offered that early treatment, focusing on airway, you know, something different, you know, I was flavour of the month, and we were just inundated.
Yeah.
I went from just working for myself for the first year to having an associate, the second year having 2 associates, and ended up we had 3 associates by the 4th, 5th year. It was that busy.
Yeah.
Yeah.
So you've travelled extensively, you have lectured globally, and you have always kept very close to the scientific research, the latest trends in orthodontics. So how do you feel that travel has really, you know, shaped the way that you look at orthodontics and also the way that you teach orthodontics?
To me, when you are invited to speak in country X, Y, Z, you kind of get to see a different side of the country. A big difference between what I did with my backpack and tried to see the whole world in 1 year, right?
Yeah.
But if I was invited to speak, you know, in Sweden, say, or Brazil, you know, you got to see what they were doing, and you know, you always learn something. And when I distinctly noticed the way it was done, for instance, in Brazil, it was a lot of removable appliances, but kids were quite compliant, right?
Right.
When I saw what they're doing in America, the same treatment, you know, early treatment, but it was fixed in. So, you know, I thought, wow, this is great, because one of the problems I had when I brought this philosophy of early interceptive treatment was some kids wouldn't wear their appliance, you know,
so the
right?
compliance.
Compliance, yeah. So if you fixed it in, it was guaranteed to work, which is what I still do today.
Yeah.
So that was influenced from, you know, watching my peers in America and how they were doing this same early interceptive treatment.
Yeah.
But I mean, I've lectured now in, I think that, gotta look at my exact figures. I know there's 192 countries, of which 2 are not recognized, Vatican and
Right.
and Palestine.
Right.
I've lectured in Palestine,
Yeah.
and I've actually lectured in Vatican to 5 dental friends of mine. So
Okay.
I don't know that.
Does that count?
I don't know. I put it down as I count. It was funny. I had a patient who was a Catholic priest, and little did I know that he became the PA to the Pope. You know, yeah. So we actually had a room in the Vatican for this little seminar and a little tour of the. So I thought, yeah, that's fine. Let's do
That's
a
quite
CPD
special.
event. Yeah. So of the 192 countries, if you include those 2, I've lectured in 180. Yeah.
That's amazing.
Yeah, I don't think I'll ever get to Afghanistan. You know, but yeah, there are, and yeah. So to me, I love traveling, and it's. And what other profession where someone pays for you to go to a country, you share your knowledge, which I love doing anyway, and you get to see all this culture.
Yeah.
I think it's
amazing.
I think that would be the most. People ask what's the best part of your life. I would say that opportunity to travel and get paid for it before you're at the age where medical problems kick in and you can't travel like you used to.
Yeah. Tell me about EODO. How did you start to create EODO? And you know, I think you teach orthodontics through your mini residency courses.
Correct.
But just tell us a little bit more about who it's for and what are they going to get out of that?
Yeah.
course?
So EODO was set up because of the number of dentists who would come to me and say, look, we like what you do, but we're in the middle of nowhere, because Australia's a big country, you know.
Yeah.
So there's only so many specialists for this much landmass. And so, you know, a lot of my associates at the time were saying, look, there's people that want to learn this technique. Have you ever thought of running a course?
Yeah.
Now, you know, I was doing a lot of teaching, as in lecturing, mainly to orthodontic study groups and things like that, for people who are already doing orthodontics but just wanted to maybe see a different way, you know, what age to treat, what appliance may be different, right? I wasn't really ever thinking of educating someone who knows no knowledge about orthodontics to the level where they could practice it. Yeah. So that was a bit of a challenge to me, and back then, you know, the Orthodontic Association was very anti spreading the knowledge. You know, I can say this, you're going to have a lot of dentists listening, that, you know, if there's one if there's one specialty in our profession that holds their cards close to their chest, it's orthodontists, right? If you have a root canal that goes wrong and you reach out to your endodontist, he's there to help you, right? Oral surgeon for wisdom tooth guy. Orthodontics, it's a very mafioso specialty, right? So again, I had all this flack from the 60 Minutes program. Then I got all these further hate mail from the Orthodontic Association saying, oh, you should be teaching general practitioners. You know, my friend Jeff Hall has gone through the same sort of thing. You can share. Have you ever interviewed Jeff?
Yes.
Yeah, you'll see a kind of parallel, you know, of that when he started teaching GP. But I was the first specialist orthodontist in Australia to allow GPs to come to my course. Now, it wasn't though anyone could come to my course. You know, if they're going to learn more about how to help a kid sleep in the airway, you know, I'd invite cleaners to the course. You understand, right? So the fact I was teaching GPs and the fact that it was like a formalized, structured program, not like a weekend thing, you know, because most courses in ortho were, I'm going to teach you just enough to get you ready to fail, because we don't want you to be competing with us. And ask general dentists, you speak to a lot of them, right?
Yeah, I do speak to a lot of general dentists.
And they'll say the same thing. So I came on the market saying, well, listen, I want to teach you good orthodontics. I want to teach you how to diagnose properly. I want to teach you which cases you can treat, which cases you should refer, you know, blah, blah, blah. So we put together, back then it was only a introductory program, and it went for about 12 months, right? And I soon learned theory wasn't enough, because if you understand the theory, but you haven't got the practical skill set to do it, then how are you going to achieve? So that 1 year now has grown through to 3 years because there's a 2-year practical component.
Right.
Orthodontics, unlike any part of dentistry, endodontics, implants, you can learn that and maybe do the procedure in a day. But orthodontics is a growing individual, particularly what I do.
Yeah.
So you've got to follow that kid for a long period of time. You've got to retain them. So you need at least 3 years to be able to achieve that. So I'm very proud that we have a formalized program. It's university recognized. If you speak to my graduates, they're doing 90% of their own ortho. They still refer, but they're comfortable in what they do. You know, their scope of practice, I think, you know, is ticked off the box of what we teach. And it also allowed me to grow my empire. Because if a doctor from Queensland needs to fly to Sydney, you know, 36 times over 3 years just to complete his lectures and clinical, it's a big ask.
It's them.
Right? Whereas if you do some online lectures and clinical in Brisbane or clinical in Melbourne, where we are now, clinical in Hobart, clinical, you know, wherever, it just means that people are more likely to commit.
Yes.
And I could never in my life be able to treat every patient referred to me. You know, we're grown to the degree where I can expand and expand and expand, but there's going to be a point of no return. So what I've now done is franchise the stuff that I do.
Yes.
You know? So I say to my good students who are in a very remote area, recently Wagga Wagga, right? Yeah.
Right.
And you know, doctor who's done my course, then worked for me, and then wants to, you know, do full-time ortho. And no point setting up an ortho practice in Sydney where there's another million orthodontic practices. Go somewhere, you know, Mackay, 2 orthodontists, I think, closed the books. Wangaratta, you know, you hear it. Country dentists always say we need, you know, the ability to grow without myself having to stretch myself beyond limits that I couldn't do. That's the future for me.
This podcast is sponsored by Arise. Are you referring patients out for sleep studies only to never see them return? That's because the journey is so convoluted. It's like sending them on a wild goose chase. Arise has created a simplified sleep study solution tailored for dental practices. Booking a sleep study with Arise is as simple as ordering on Amazon Prime. Your patient books online, the Level 2 sleep kit is delivered to your clinic, They use it at home, and the specialist report hits your inbox in 2 weeks. Dr. Derek Mahony, after trying numerous sleep study providers, now uses Arise exclusively across all his clinics because of its simplicity and accuracy. Stop letting your valuable patients walk out of the door. Unlock your practice's sleep potential today at arisesleep.com.au.
15 practices is no small feat.
Not at all, not at all.
So how do you juggle practice ownership, as you said, and how do you make sure that your philosophy is spread throughout all of these practices and your quality is there, you know, your patient care, which you've started in Randwick?
Yeah.
So how have you managed that?
The only people who work for me are people who have the same philosophy, right?
Yeah.
Call it religion, you know?
Yeah.
And therefore I know that we're all on the same team, we all think the same way, and we're providing the same level of service, right?
Yeah.
And that would be, when would we treat? What are we looking at? You know, now I have a great group of specialists as well, you know, max-fac surgeons, enos and throat doctors, and I set up these networks so it's just really easy to grow the practice.
Yeah.
But I still do, to this day, every new patient exam, and that keeps me busy because I'm literally on a plane 2 or 3 times a week, right? So I might do, like next week, I'm 2 days in Tasmania, 3 days in Brisbane, 2 days in Melbourne. That's the week gone. Right?
Yeah.
Yeah. But I enjoy doing it. It might sound crazy. You know, so, you know, I say to anyone, whether you're a dentist or anything, like the moment you wake up and you don't want to go to work because you think, oh my God, do I have to do that? That's time for a career change or retirement. I haven't hit that wall.
Yeah.
You know, I love what I do. You know, and I love being able to help kids. You know, these kids that have you know, misdiagnosed problems, whether you want to call it global development delay, ADHD, all these new terms we come up with that we never had before. It's the kids' sleep.
Yeah.
And you know, my PhD research, thanks to Linda Aronson, you know, put me in the research pathway. I really understood what good research is. Took me 16 years to complete it, but I looked at children anatomically, and I looked at who had poor sleep and good sleep, and it was so obvious to link the narrow jaws, the retrognathic jaws, with the poor sleep.
Yeah.
So, you know, up till now, how were these kids being treated? Well, they weren't. They were being heavily medicated, or they would be put on CPAP. Done, you know. Yeah. We came up with a philosophy that diagnose it properly, and if it is airway, don't just treat the teeth, treat the airway. And that's what I'm big on now. I mean, I get invited to speak all over the place on that topic.
Yes.
Where we talk about how to diagnose it correctly, and then how to widen the jaws and bring the jaws forward. And if you do that, you're helping that child
Yeah. Coming back to practice ownership, I'm sure you've had many challenges along the way. Is there anything that sticks out for you, and how did you turn it around to become a success?
Challenge has always been and continues to be staff.
Yeah.
All right? I think every dentist would agree on that,
Yeah.
right? The bigger you grow, the more difficult it is to get staff. You know, and if I limited all my practices to just one in each capital city and kept my key staff, which would be 20%, right?
Yeah.
I think it'd be even more productive, right?
Yeah. You
almost feel like Caesar when, you know, he couldn't control his borders anymore because he just didn't have the troops, right? So I found a way to overcome that hurdle, and that is recruiting overseas trained orthodontists, right? You don't have to convince too many people to move to Australia, right?
Yeah.
I'm talking about, you know, the 2 countries that there's more orthodontists than taxi drivers, Brazil and India, right? Why? Because there's so many private schools. And it's a race to the bottom in those countries because at the end of the day, the demand is not as much as the supply, so prices go down. Basic economics, right? So as a result, they're looking for a better lifestyle. So I sponsor a lot of these young orthodontists to come here, They work in the clinic with me, doing things like cephalometric tracings, steri, nursing, reception, right?
Yeah.
But they're they're going to stay with you long term because they've already chosen the profession. They've done a basic dental degree, they've done postgrad.
Yeah.
It's just unfortunate they did it in a country where the economic game is not as good.
Yeah.
So they come here, I help them get into their ADC program. They tend to pass it quite well because we're talking, they're the upper echelon of their dental profession, and then many of them stay on and work with me in the mouth. Mm-hmm. So I just found that's been really rewarding for me. One distinctive young lady from Colombia could hardly speak English, right? Was willing to clean houses, just to pay her tuition and study her ADC. So, I gave her a job as a dental nurse. She excelled at that. Her English improved. She then became a treatment coordinator, and eventually she passed her ADC.
Yeah.
And then she didn't want to go. Here's the other thing. If you become an orthodontist overseas, you don't want to then go back to general dentistry in Australia just because you've got a dental license.
Yeah.
So, and it's very hard for them to become specialists because of the way things are structured here. So they come back and work for me, knowing what they do, having great experience, and getting good remuneration.
Yeah, it's amazing.
So I think the staff shortage, I've turned around by an active recruitment process of people who want a better lifestyle in Australia. I think and it's very rewarding.
That's very clever.
Yeah.
I speak to a lot of dentists, and what I find when I speak to dentists, regardless of how successful they are, they often compare themselves to their peers. They often feel they haven't done enough. They're constantly striving, high achievers like yourself. So I'm just wondering, have you ever felt that pressure in your career pathway? Have you ever felt that, it's not, you're not there yet? You're just still...
It's a tough question. I know my partner, Leah, always, when I want to go to a conference, to actually, she goes, "Oh my God, don't you know it already? Why are you wasting another day? I'd like to go sightseeing," or blah, blah, blah.
Yeah.
I think all of us in the profession have a thirst for knowledge, right?
Yeah.
And I don't think everyone, what I'm doing now, maybe 10 years will be different because there'll be newer technology, right?
Yeah.
Remember, I was an undergrad dentist when implants weren't even heard of. There were no computers, by the way.
Yeah,
no
computers.
Do you understand?
Yeah.
I think when I did my postgrad, we had the floppy disk thing,
Yes.
Most people wouldn't.
I remember that.
Yeah, there was no Google, no chat TV. Yeah, so things progress. So I would say I've never felt as though, I think for what you're asking me, there's a lot of pressure for young dentists when they look on things
Actually, not just young dentists.
Yeah?
No.
Really?
It's quite surprising, but I think there is this pressure that they often feel that they're comparing themselves.
Right.
And so I just wondered if that was, or what would your advice be?
Look, I know that with social media, everyone's going to post their best cases, and I see on DPR sometimes a new grad doing crazy things like sinus lift implants, and and maybe the guy in his ear going, "Oh my God, I'm way behind the crowd." But ultimately, what is safe versus what looks lucrative on YouTube, etc. Yeah. So I don't think. I think camaraderie, peer. Is good. I think the ADA does a wonderful job in that regard with their peer advisory services, and so I would say I've never felt that. But I guess I'm not the norm, when it comes to that. But I would say to other dentists, don't just look at one thing and say, where am I? Talk to your other peers, and you kind of find most dentists, I know dentists do the best for their patients. There's no doubt about it. Unfortunately, we always get beaten up in the media, don't we, right? There's never a good dentist story. Some guy shoots a line, and because it's a dentist, front page news, there's always how can I put it? I believe that dentistry is a basic necessity, just like medicine.
Yeah.
But unlike medicine, the government doesn't contribute to it. Transport, is subsidised. Medicine is subsidised.
That's right.
So you have all these patients who think, oh, we're rich, we don't do anything for the good of healthcare. But they, and that could be a lot of strain for a dentist as well. You think about a new grad, they've got a massive HECS debt, right? They've got to be successful in a short time. They've got, patients who are demanding. It is a stressful career pathway, right? I mean, again, I was always been lucky at the right time. I had my undergrad paid for by government. I have 0 HECS. Whitlam government paid your uni degree. The Navy paid for my orthodontic degree.
That's
so
great.
I guess I was able to get a head start earlier. But I think for younger dentists, just start with the basics and get really good at that, and then find a good mentor. And again, I like the ADA mentoring program. I donate. I offer my time as a mentor. And they were surprised. Orthodontist mentor, we've never had that. I said, why not? And I have, other than people who I teach in my EODO, I have mentorships with dentists through ADA, where we meet once a month, and I sit down and I go through, stuff that would help them better. I also mentor a lot of people in business. I claim to fame, I've done my MBA at Wharton University, and I did that because if you've got 15 practices, you're never taught how to be a good businessman, right? And I needed to get knowledge in that. Recently, I've finished training at Harvard Medical School. I always wanted a Harvard Medical School certificate, and this is in AI in dentistry. So that, of all the courses I've done, that course on AI in dentistry and my business training were probably the ones that I really enjoyed the most.
So that brings me on to my next question, which is really exciting, about the future of dentistry and orthodontics. So what do you think is the latest advancements, or the most exciting for you, that you see is going to shape ortho? Digital.
Everything is digital. Aligners make tooth movement predictable now. When I graduated as an orthodontist, you had to be good at wire bending, right? You had to be good at bracket positioning. Now with AI and computer, it's crazy. I mean, there will be a time within my career where a patient will sit there, you'll do a scan, it'll be uploaded, AI will get everything where it is, including the diagnosis. I mean, it's funny, one of my students recently put in all his cephalometric data and all his clinical notes that I teach him to do to present to me for case diagnosis. He put it through ChatGPT and it came up with the perfect diagnosis. Frightening, right? And then after doing a couple of those, it kind of modified the appliances to suit the appliances that practitioner liked. So think about that. That's not even a commercially available
and it's
thing.
only in stage 2 of the whole AI. I mean, this, until it's completely autonomous. So it's something that really fascinates me, the future. So I think that's something that most dentists are still looking at and just wondering, is it safe to use? But
I think it's still the brave new world, but I mean, you'd be lost without it.
You would.
And I guess, COVID made us think outside the box, didn't it?
It did.
The dental monitoring, no one needs to necessarily come in every visit for you to look in their mouth and say, change that elastic or go to the next side. A lot of the stuff we do is virtual, which is great when the distance people have to travel. People don't want to come once a month like they used to the orthodontist. So I think that also is AI, and that's just about to, So, 3D printing, CBCT, AI in diagnostic. It's a great time to be in my profession.
It's a very exciting time. If you weren't an orthodontist, what would you be doing today?
I have no idea. I mean, you know, if I got in, say I got those extra 2 marks.
Oh,
right?
yes.
Yeah.
Yes.
What would I have done? Well,
you would have gone and become a doctor.
Yeah, I mean,
would you?
The only people that I'm kind of jealous of would be plastic surgeons. Okay. I think that's pretty cool. So, yeah, maybe if I had my time again, I got into med, I'd probably specialize in plastics. Because what they do, it's very analogous, because I work with a lot of plastic surgeons, because, you know, my practice is full face orthodontics, yeah. So that'd be what I'd like to have done, but I just wasn't clever enough to get in there. My passion now, which I'm actually, I think, business-wise doing well, is my winery.
Yeah.
And I've always, like every dentist, I've always enjoyed drinking wine.
Yes.
And it's only when I was lecturing in France and I sat in on this sort of 3-day masterclass on appreciation of French Bordeaux, you know?
Right.
And I thought, my God, there's like, you know, 300 steps that go into this final wine, from, you know, your terroir to the grape you choose. And I thought, this is really, you know, as an orthodontist, same thing. You look at all these variables and you try and get the best outcome you can. Winemaking is the same.
Right.
So to me, my retirement is definitely going to be on my vineyard.
Yeah.
You know, I've invested a lot of money in my latest vineyard, which is in the Hunter Valley, and we're putting in a massive lecture centre. So what I'll be doing is, as I retire from clinical practice, we'll be, you know, teaching in the vines or something like
amazing,
that.
Isn't
Yeah,
it?
where my winemaker, who's super talented, he runs courses on viticulture. Mm-hmm. It's called WSET. Analogous, I run courses on orthodontics. So, you know, like in theory, you could get a spouse and their partner, male, female, whatever, come, and they don't both have to be wanting to learn ortho, you know. One can learn orthodontics.
Great.
They can still do clinical, because I'll have a clinic on the farm. Yeah. The other can appreciate good quality wine. So I like that. I mean, it covers the teaching. Yeah. It covers the travel.
Yeah.
Probably less headache than treating patients. You know, have you ever had an unhappy customer who drinks wine? No. They love it. You know, have you ever been on a wine tasting tour? There's never unhappy people. So I think, you know, I love our profession, and I do love the majority of my patients, but some patients you love more when they leave the practice, you know what I mean? Yeah. So there's no stress in that business model. Yeah. It's enjoyment, you know.
Well, it brings me on to my next question, which is, if you only had one wine to drink for the rest of your life, right, what wine would that be?
I can tell you that straight off the bat. It would be a de Romay Conti Pinot. So that Burgundian Pinot Noir, you can't beat it. A lot of these wine labels, you know, they are overrated because of marketing or because of snobbery, but that one wine is super, super special. You know, people are going to say only an orthodontist with 15 practice can afford to drink that. Yeah, I don't drink it every day, right? Yeah, but it's a generation from the monks who set up the vineyard to what is presently there, and it is the best you can get in that thing. I'm trying to clone this stuff in Australia, by the way. Yeah. Okay. The reason I moved
how far have you gone?
Well, the reason I moved down to Tasmania, because that wasn't really a big capital city for me, is because the Pinot Noir that I was growing, that, you know, global warming, it affects lots of people. It affects the winemaker a lot. So I need to find cooler climate. Right. So we found that in Coal River Valley, which is south in Hobart, and we are growing almost the identical clone to Burgundy. Early days, right? But my hope is one day I can aspire to have something
very similar.
Yeah, exactly.
Yeah. What are you excited about for the coming year?
Coming year, what was exciting for me was a lecture tour I did in Croatia, because I'd never lectured in Croatia. That was one of my bucket list to go.
Yeah.
So I have certain countries that I haven't lectured and I'm slowly ticking off. I'm lecturing in Tanzania next year, you know, so these are exciting things for me. So I look forward, if you ask me what's the most forward thing I look forward to, I mean, I enjoy what I do, but you know, I look forward to having a weekend where I'm not lecturing, where I can go to the farm, to the vineyard, and an ability to still travel, but to a country I've never been to before.
Okay. Yeah, well, that sounds great. So for any of our listeners who are listening and wants to know more about your referral practices for the children in their practices, the free lectures that you offer, and also the EODO, how do they find out a little bit more? Yeah, so the website where we put all our teaching materials is called eodoteachable.com. And it really is an amazing algorithm. This has been a 35-year journey to get this up and running, right? And I think I told you this before, like in my will and testament, which I've already done, because you know you're not getting younger or anything, all of my lectures that I've taped, all my teaching, will all become free for the rest of perpetuity, you know, because I still believe in teaching. You know, unfortunately, none of my 4 kids ever followed in my profession, but you know, that's why I always envy your dad. So he was very happy when you became a dentist, Keita. He was happy, yes. Yeah, I'd be ecstatic. Anyway, different story. So on this website, we have recorded the entire program for dental sleep medicine, the entire program for dentofacial orthopedics and what we're doing, and also latest offering is aligners, which is very popular, you know. And it's structured online learning. So for people who want to learn more, that's the way to go. But I always say, you know, many people have heard about me or read about me, or I'd love people to come and meet me. So we offer at no charge, as you know. People come and hang out with me for a day. I don't charge anything. They kind of get to see patients I see, how I look at things, how my practices run. And I particularly like doing that for young graduates. You know, all my courses, I don't charge undergrads. So I get all these students because that's the best time, you know. And we do charitable stuff, as you know, with Eston Foundation, and you know, all that sort of thing. So, so for people who want to learn more about orthodontic education and the way I do, definitely EODO Teachable. As far as the referral for the practices, you know, we have a great website, and thank you very much for your help in both of those. And that's fullfaceorthodontics.com.au. I think we've got .net.org, all the full faces. It'd be amazing if people have copied full face these days. Right? So full face orthodontics is my, you know, patient you want treated or advice on your patient, but to learn good quality orthodontics, EODO. Yes, and we'll make sure that those web links are in the show notes for this podcast. But Derek, I just want to say thank you for being here today. I find your story incredibly inspiring, how much you have achieved, and also persevered even through the tough moments. But from what I see, I really feel that the key thing is your generosity, and your generosity and mentorship of your students, and not only your students, but also for the profession and globally. And that's truly commendable.
Thank you.
So I just want to thank you for being here, because I think our listeners are actually going to take a lot away from this. Particularly in your resilience and your growth and leadership. So thank you so much.
Yeah, pleasure. And I remember, you know, how I met you. It was through Simon Lee, one of my students, right? Yes. We're at the stage where I wanted to, you know, my problem was we were so busy. We never had a marketing department, you know what I mean? And every dentist is the same. They just, the hygienist on the day or whoever, they say, okay, you're in charge of marketing now, do the socials. Okay? And then it just goes like that. And Simon Lee said, oh, you know, you should go and talk to it was your brother at the time, you know. He said,
He's still my brother.
That didn't come across well, isn't it? It was at that time when I was talking to Simon. That's good, yeah. And Simon said, look, these guys do a really good job.
Yeah.
And so since then, wow, like I would say, and I'm just saying this because you interviewed me, a lot of my practice success comes from my websites, my newsletters that you guys put out.
Yeah.
And yeah, it's really, really good. So yeah, big plug for Dental Focus Marketing.
Well, thank you.
And I'll share this with you. I wanted to tell you a while ago, it just gets busy. But you know, when I did that MBA at Wharton, we had to do a case model. And of course, I did full face orthodontics as a case model. And there's one subsection on that, which is social media marketing. And I just cut and paste everything you put together for me. And my professor was so amazed.
Yeah.
And I got my highest mark on that paper.
Well done.
Yeah, so
well done.
So what do you call it, plagiarism or whatnot? But I said, this is working for me. And you know, what model do I want to learn about or better so I can get advice from? These are big guys teaching there, you know. And they were kind of really impressed with the way we do the updates in them. So I think from a marketing point of view, you guys would all weigh it up. Thank you.
Yeah, thank you so much. Well, thank you for being here.
Thanks for tuning in today. If you'd like to take your learning further, simply scan the QR code on screen or head over to eodo.teachable.com. Please note, the views shared are personal to our guests and not official advice. All treatments carry risks. Consult a qualified health practitioner to determine if a treatment is right for you. For surgical or invasive procedures, seek a second opinion from an appropriately qualified health practitioner. Always consult a licensed health professional for your specific concerns. Enjoy the show.